Hello, good day everyone. I am Guadalquiver from the SN11G Group 57, and so for today, I'm going to perform a proper demonstration about preparing medication from an ampule via parental medication administration using the intramuscular and the subcutaneous. So first and foremost is to check for the doctor's order. So prior to conduct of the procedure, the first thing to do is to check for the doctor's order and the patient medication administration record, which is the MAR. This is done so that we will be able to identify what kind of drug is to be given to the assigned patient. So we have to determine the drug's name, the dosage, the route of administration, and the time it is to be given. And check the label on the medication carefully against the EMAR to make sure that the correct medication is being prepared. Then we also need to check for the label of the medication against the patient medication administration record to ensure that we are going to prepare the right medication. Now, in medication administration, it is important to perform the 3 checks. For administering medications, we need to read the label on the medication when it is taken from the medication cart, and we will have to read the label again before and after withdrawing the medication. Organize the equipment. So the equipment that we will have or we will use is we have the alcohol, we have the alcohol pad, we also the hypodermic tray, and also we have the sterile water which will serve as the medication for this demonstration. Also we have cotton balls which is soaked in alcohol. We have this micropore cotton tourniquet. We have an eggplant to substitute for the actual skin of our patient later, and aspirating needle. And also we have the 1, 3, 5, 10 and cc syringes, and also we have the ampules. So now I'm going to proceed the preparation of medication from a vial. Perform hand hygiene and observe other appropriate infection prevention procedures. So before I do that, I'm going to perform hand hygiene to observe appropriate infection prevention procedures and to deter the spread of the microorganisms. And prepare the medication vial for drug withdrawal. So if the medication still needs to be reconstituted, then the vial would contain the powdered form of the medication and diluent must be added into the vial. So after adding the diluent, we must mix it thoroughly by rotating or rubbing the vial in between the palm of our hands. After doing that, I am going to prepare the syringe. So I am going to open the pocket. It is important to remember that we can only touch the barrel and the plunger of the syringe to avoid contaminating the needle. Now, since this comes with the needle already, I'm going to loosen up first so that I can connect my syringe into an aspirin needle. Then connect the barrel into the aspirin needle. Ensure that the connection is loose. Mix the solution if necessary by rotating the vial between the palms of the hands and not by shaking. And remove the protective cap. And clean it with an antiseptic wipe or by rubbing in a circular motion. So I already opened the covering of the vial, and also I'm gonna clean the rubber cup with the use of the cotton balls which is soaked in alcohol in a circular motion, and discard the cotton ball. Withdraw the medication and attach an aspirin needle as agency practices dictates to draw up premixed liquids medication from multi-dose vials. Ensure that the needle is firmly attached to the syringe. Remove the cap from the needle, then draw into the syringe an amount of air equal to the volume of medication to be withdrawn. After doing that, I'm going to get the syringe and uncap it. Then I'm going to draw air into the syringe an amount of air equal to the volume of medication to be withdrawn. So inject the air into the vial and keeping the level of the needle above the surface of the medication. and withdraw the amount of medication using either the following methods. Hold the vial down with the base lower on the top and move the needle tip so that it is below to the fluid level and withdraw the medication. So invert the vial, ensure that the needle tip is below the fluid level and gradually withdraws the medication. So I'm going to invert the vial and draw the exact amount of medication needed. After doing that, if you see an air bubble, inside the syringe, then you can lightly tap the barrel of the expelled air bubble. Inside the syringe and lightly tap the barrel and expel the air bubble. Then I'm going to remove the aspirating needle. Then I'm going to remove the aspirating needle and join the raised receptacle to avoid needle prick injury.
Gahi no, pag
Then I'm going to remove this aspirating needle and throw it into the waste receptacle to avoid needle prick injury. Then connect this barrel to the appropriate size needle, and now I'm going to place the syringe and the medication into the hypodermic tray. And now I'm going to put this on the hypodermic tray, and I'm going to write the medication ticket so that we won't forget the medication. It is the dosage for who it is assigned to. Preparing medications from ampules. So now I'm going to proceed the preparation of medication in an ampule. So this is what an ampule looks like. So perform hand hygiene and observe the appropriate infection prevention procedures. So before I do that, I'm going to perform hand hygiene to observe appropriate infection prevention procedures and to deter the spread of the microorganisms. Prepare the medication ampule of drug withdrawal, and I'm going to prepare my syringe. So I have here my 5cc gold 23 syringe for my intramuscular injections. So I'm going to open the packet since my syringe comes with a needle, so I'm going to loosen up first, so that I can connect it into an aspirin needle. So an aspirin needle will help reduce the risk of having glass into the medication. So I'm going to connect my syringe into the needle and make sure that the connection isn't loose, that I'm going to set it down first. Use an ample opener or piece of sterile gauze or alcohol wipes between your tongue. So, in the ample neck or around the ample neck, and break off the top of venting it toward you to ensure the ampule is broken away from yourself away from others. After doing that, we are going to get a gauze or a cotton ball. Hold the cotton balls between the fingers and the neck of the ampule and break the ampule away from you and away from the people of caution. Use an ample opener or place a piece of sterile gauze or alcohol wipes between your thumb and ample neck around the ample neck and break off the top by bending it toward you to ensure the ample is broken away from yourself and away from others. After doing that, we're going to get a gauze or a cotton ball. Hold the cotton balls in between the fingers and neck of the ampule, then break the ampule away from you and away from the people just for caution. And dispose the top of the ampule into the sharp container. After doing it, we're going to discard the broken neck of the ampule in the sharps container and set it down. And withdraw some medication. With a single dose ampule, hold the ampule slightly on this side and aspirate the medication. Then we're going to get our syringe, then we're going to withdraw the medication. With a single dose ampule, hold the ampule slightly on this side and aspirate the medication. Then we're going to get our syringe and then we're going to draw out medication. If giving an injection, replace a sparing needle with a regular needle. So now I'm going to recap the needle so I can take the aspiring needle off. And discard the aspiring needle into the sharp container so that we can avoid the needle prick injury, and then connect the syringe into its right size needle. Tighten the cap and the hub of the needle, place it over to the medication tray. So now I'm going to place this into the medication tray and then I'm going to write the medication ticket. So for the subcutaneous injection, the subcutaneous administration is the introduction of a small amount of solution into the adipose tissue beneath the skin by the means of syringe and needle. So perform hand hygiene and observe other appropriate infection prevention procedures to deter the spread of the microorganisms. And provides for privacy and prepares the client. Prior to performing the procedure, introduce yourself to the client and verify the patient's identity using the agency protocol. So hello, good day ma'am. How are you feeling today?
I'm good.
Okay, that's great. So ma'am, may I know your full name please?
I am Crisanel Caparos.
So, when is your birthday?
October 8, 2003.
How would you like me to call you?
Please.
Okay, so when is, what language do you prefer? Do you prefer English or Bisaya?
English.
Okay, that's great. So, explain the purpose of the medication and how it will help using the language that the client can understand. Includes the relevant information about the effects of medication. So, Ma'am Chris, today I will be doing the administration of your insulin. So, insulin will help your body to control your blood sugar as you have a type 1 diabetes. So okay, I'll be injecting your insulin in a subcutaneous layer of your skin over your shoulder. It is okay with you, Ma'am Chris?
Yes.
Okay, good. So now I will close the door so no one can disturb. as while doing this, okay? So assist the client to a position in which the arm, the leg, or abdomen can be relaxed depending on the side to be used. Obtain assistance in holding the uncooperative client. After that, I'm going to assist my patient into a comfortable position with the arm, leg, abdomen can be relaxed depending on the side to be used. Obtain assistance holding an uncooperative client. And select the clean side. Select a side free of tenderness, hardness, swelling, discoloring, itching, burning, or localized inflammations. Select a side that has not been used frequently. So let me see your shoulder, ma'am, please. Okay, I see. Pull this over. And apply gloves. As agency protocols indicates, clean the site with an antiseptic swab. Start at the center of the site and lay it in the widening circle to about 5 centimeters and 2 inches. Allow the area to dry. Place and hold the swab between the third and fourth fingers of the non-dominant hand, or position the swab on the client's skin above the intended site. Then prepare the syringe for injection. Remove the needle cap while waiting for the antiseptic to dry and pull the cap straight off to avoid contaminating the needle by the outside edge of the cap. And inject some medication. Grasp the syringe in your dominant hand by holding it between your thumb and fingers with the palm facing up to the side or upward for a 45-degree angle insertion, or with the palm downward for a 90 angle insertion. Prepare to inject. By using your non-dominant hand, pinch the skin and hold syringe in your dominant hand by holding it between your thumb and fingers. Using the non-dominant hand, pinch or spread the skin at the side and insert the needle using the dominant hand in a firm steady push. When the needle is inserted, move your non-dominant hand at the end of the plunger, and some nurses find it easier to move the dominant hand to the barrel of the syringe and dominant hand at the edge of the plunger. And inject the medication by holding the syringe steady and depressing the plunger with a slow, even pressure. And remove the needle smoothly, pulling along the line of insertion while depressing the skin with your dominant hand, and discard the needle. If bleeding occurs, apply pressure to the site with dry sterile gauze until it stops. Dispose of supplies appropriately and put it to the waste receptacle. So, okay, Ma'am Chris, how are you feeling?
Good.
Okay, that's very great, Ma'am Chris. Okay, so we're done. I'm going to head out now so that you can have some rest, Ma'am Chris. And if you need anything, don't hesitate to call me using the call button so that I can come back here and attend your needs. Okay? So, do aftercare and remove the gloves and dispose used items in the appropriate waste receptacles. Return other equipment to the proper place, especially to the MAR machine. After doing the procedure, discard the gloves and use the appropriate waste receptacles and perform aftercare of the equipment and returning to its proper place. perform hand hygiene. Assess the effectiveness of medication at the time it is expected to act. After that, I'm going to assess the effectiveness of the medication at times it is expected to act and document all relevant information and also document all relevant information during the procedure. Okay, thank you, Ma'am Chris, and have a nice day. For the intramuscular injection, so now I'm going to proceed to the intramuscular medication administration. It is the introduction of the medication deep into the muscle tissue where there is a large network of blood vessels that can absorb the medication quickly. So after preparing the medication, head to the patient's room, introduce yourself to the patient, verify the patient's identity, and also ensure the patient's comfort and privacy. And also secure that by closing the doors, the windows, the curtains, adjust the room temperature, and provide adequate lighting for the patient's comfort and privacy. So hello, good day, ma'am. Let me introduce myself to you. I am Guadalquiver, your student nurse for today. So may I know your full name, please?
I am Parental Medication.
So, when is your birthday?
October 8, 2003.
How would you like me to call you?
Chris.
Okay, what language do you prefer? Do you prefer English or Bisaya?
English.
Okay, that's great. Thank you. So, Ma'am Chris, today I will be administering your medication that has been prescribed by your doctor. The drug name is the cortisone. It is an anti-inflammatory which will help you with your tendinitis. Okay, so I will be injecting this medication in your shoulder. Will that be alright with you, Ma'am Chris?
Sure.
Okay, thank you. So I will just close the door so no one will disturb us while doing this procedure. Assist the client into a supine, lateral prone, or sitting position, depending on the chosen side. If the target muscle is the gluteus medius or the ventrogluteal, have the client in the supine position and flex the knees. In the lateral position, flex the upper leg, and the prone position, toe in. After explaining the procedure to the patient, proceed with assisting the patient in a comfortable position depending on the chosen side. How do you straighten your leg, please? Obtain assistance in holding the uncooperative client. Explain the purpose of the medication and how it will help using language that the client can understand, include the relevant information about the effects of the medication. Select, locate, and cleanse the skin. Select the site of free skin lesion, tenderness, swelling, hardness, or localized inflammation, and one that has been at least repeatedly. So now for intramuscular injection, we need to select a site that is free of skin lesions, tenderness, swelling, hardness, or localized inflammation. And if injections are to be frequent, alternative site, avoid using the same site twice in a row, but remember that it should be the site for the injection, and locate the exact site of the injection. Please, can you see your shoulder, please? You can do it, please. So I see that there are no conditions, any hardness, any dryness.
Have you tried this soap?
Then also apply gloves. Clean the site with an antiseptic swab using a circular motion. Start at the center and move outward about 5 centimeters and 2 inches. And transfer and hold the swab between the third and fourth fingers of your non-dominant hand in readiness for the needle withdrawal, or position the swab on the client's skin above the intended site. And prepare the syringe for injection. So we are going to get the syringe and remove the needle cover and discard without contaminating the needle. If using a pre-filled unit dose medication, take caution to avoid dripping medication on the needle prior to injection. If this does occur, wipe the medication of the needle with a sterile gauze. Inject the medication using the seed track technique. Now we are going to advance the needle into the patient's skin. Uses the ulnar side of the non-dominant hand to pull the skin approximately 2.5 centimeters or 1 inches to the side under some circumstances, such as for an emaciated client or an infant, the muscle may be pinched. Holding the syringe between the thumb and the forefinger as holding a pen, pierce the skin quickly and smoothly at 90 angle. Hold the barrel and the syringe steady with your non-dominant hand and aspirate by pulling back to the plunger with the dominant hand. Aspirate for 5 to 10 seconds. If blood appears to the syringe, withdraw the needle, discard the syringe, and prepare a new injection if blood does not appear. Inject the medication steadily and slowly, approximately to 10 seconds ml. And withdraw the needle. And activate the needle safely device or discard the uncapped needle and attach the syringe to the proper receptacle. And remove and discard gloves and perform hand hygiene. So ma'am, we are done with your intramuscular injection. How are you feeling now? Okay, that's great. So since we are done, I'm going to let you have some rest now. So I'm gonna head you out. If you need something, just call and use your call button, and I'll be notified in the nurse station and come back here to attend your needs. Okay. So remove and discard the gloves and perform hand hygiene. And document all the relative information, the time of administration, drug name, dosage, route, and the client's reaction. And document the relevant information of the time of the administration, the drug name, the dose, route, and the client's reaction to the procedure. And assess the effectiveness of the medication at the time it is expected to act. And that's it for the parental administration using the intramuscular and the subcutaneous. Thank you.